He was swallowing pretty strong.
Hi, everybody. We'll be beginning in a few minutes.
Like this. You say he know?
April 1 to 17. They just had it. I was in here.
Big hustle.
I was just in here, man.
All right. Tonight we're talking about Medicare. Medicare is broken up into many parts. You got your Medicare Part A, which is generally paid for by the government. The deductible is on a 90-day rotation. So every 90 days it restarts. Limited coverage up to 90 days in a hospital. And you do get a one-time extension on that to 120 days. Medicare Part B, which is your doctors and your physicians, is one-time deductible, usually set around April 15th. There is a premium that you must pay with this. Right now it's around $134 a month, billed quarterly. You must have Medicare Part A and B to get Part D, Part C, or supplement. Next, let's talk about Part D. Part D is your prescription drug coverage. As I said, there is Part A and Part B that must be had with this. Part D has several parts to it, from your initial deductible, which can be anywhere from $0 up, but determined by the carrier. Then basically you get your different tiers, and some carriers will make $0 deductible for tiers 1 and 2. So basically it depends on the carrier as to how the deductible is determined. After you meet your deductible, you got your next section where you're paying a small little amount, and it's shared what you're paying and what the insurance company's paying towards getting you to the donut hole, which is right now around $3,500. Once you enter the donut hole, you pay much more for your prescriptions. Then when you come out of the donut hole, which is about $5,100 that you spent, then basically you're in the catastrophic coverage area. And at this point, you're paying very little for your prescriptions. There can be government help. We do have ways to look for government help, such as LIS funding, and other ways to get you help within this. The next part is supplements. With Medicare supplements, they are broken up into different parts: A, B, C, F, G, K, L, M, N, and not all of these are offered in all areas. C and F are going away in 2020. You will not be able to get them anymore. The question is if they're going to be grandfathered or not. And the premiums are determined basically by which plan you're in and how old you are. The next type of coverage that you can get is a Medicare Advantage plan. This comes with your Part D included, where the supplements do not. So you'll have basically two premiums with a supplement. This, you have one premium that ranges from $0 to about $99 on average. Premium is set and controlled by the insurance companies, and CMS rarely goes up. It's not controlled by your age. And with Part C, even though you have to have Part A and B, you will have one deductible for each. That deductible is a yearly deductible. And then basically after that's met, it's co-insurances and co-pays. Another thing that's great to have with these is health supplements that can help offset the costs. Like with Part C, you get vision, dental, hearing. That's not always included with the supplements. And we have also plans that we can help you with to help offset more of those costs and the copays of those. Then also you can get like a hospital indemnity, a cancer policy, and those can help offset the costs. There's also Medicare gap policies. So those are things. If you also want us to do a retirement planning, then we would have to set a second appointment for that, but we could do so. Please check in with us. Give us a call at 662-292-6271 or check out our website at kensinsuranceagency.net, and you can request an appointment there, and we'll be glad to help you with all your Medicare needs. Thank you and have a nice